Reports indicate that tuberculosis continues to take the lives of many Ugandans, despite the availability of free medical checkups and free medication in public and private health facilities. Studies show that many TB patients stop taking their medicines when they no longer show symptoms like cough, lack of appetite, and chest pain, among others. As a result, the disease progresses into a multi-drug resistant TB. Studies show that multi-drug-resistant TB infects 1,500 people annually, with just about half 700 people only able to get treatment.
Highest we have found, which is last year, was 761 MDR-TB cases. So there are a number, half of the MDR-TB cases are out there spreading the drug-resistant form of TB.
TB affects mostly men, with 3 out of 4 patients being of the male gender, and is concentrated in the central region in districts including Mukono, Wakiso, Luwelo, among others. The rate of infection is said to be high in public places like markets, places of work, and bars.
And also where people spend their times in the evening and also in the day, workplaces, crowded places where they go to watch football. So that's why we think that there's a lot of MDR-TB in central region.
So even when they get these symptoms of cough, fevers that are never going, especially in the evenings, weight loss, chest pain, loss of appetite, as long as they can continue to work, they are unlikely to show up in our facilities. So they come only when they are failing to do what they want to do.
In many of the government hospitals and health centers, the public can seek free diagnosis and treatment of the killer disease. But experts say there are still many patients who still seek self-medication from private pharmacies. This is largely due to stigma, self-medication, and lack of trust, among others. This has been compounded with use of local medication or herbs. Experts warn that patients who opt for self-medication and or don't get proper dosage have chances of progressing to multi-drug resistant TB, as well as more degeneration of the affected body parts.
Those that claim that they treat tuberculosis, some of the experiences we have seen or we have had, they get these drugs and crush them and put in the jerry cans, in the herbs. But they don't know how much they have put there. When you're taking your hadomla, you don't know how much of that they have given you, which dose you should take. So in that form, you might take a TB drug, but probably not in the right quantities or in the right quality, which is not good.
But by the time they come to the hospital, there is a delay in diagnosing them, so the TB has already affected their lungs and they may get scarring. So that even if they cure of their TB, they will have permanent lung damage. But also, these herbs can affect the kidney and the liver. So by the time they come, they must be admitted, and we must struggle to see how to give them TB drugs. When they have liver and kidney injury, they spend more time in hospital, and the outcomes can be poor.
Government purchases TB drugs from World Health Organization recognized entities. These drugs have been tested and approved for use. Patients are, however, encouraged to mind the storage of these drugs once they get them from hospital, since poor storage affects the effectiveness of the drugs. Ramson, Church of Uganda Family TV, News at 8.